Hello aspirants, welcome back to our channel Smart Preparation to Success. As a part of our Tgpsc group and daily answer writing, today we are going to discuss day 67 and 68 answers. Let's start. First question, digitalization, skill-based learning are transforming India's education landscape, but they also risk deepening regional and social inequalities. Critically analyze this statement with reference to national initiatives and Telangana education reforms. Digitalization and skill based learning are central to India's education reforms, especially under the National Education Policy 2020. They aim to enhance employability, accessibility, and quality. However, unequal access to digital infrastructure risks reinforcing existing inequalities. Digital initiatives, Diksha platforms via PME Vidya have democratized learning by providing free content. Skill based programs, Skill India Mission, align education with industry demands, reducing unemployment. Telangana has also taken productive steps through TSAT, digital classrooms, and English skill development programs, improving access and employability. Challenges: the digital access divide, especially in rural and tribal areas, limit access due to lack of devices, internet, and electricity. Social inequalities such as gender gaps and economic disparities further restrict restrict participation. Skill-based education may also sideline foundational learning if not balanced properly. In Telangana, despite progress, disparities between urban Hyderabad and rural districts remain visible. Thus, while digitalization expands opportunities, it may inadvertently widen regional and social gaps under supported by inclusive infrastructure and policy design. Conclusion: digital and skill based reforms are transformative but must be inclusive, bridging the digital divide through infrastructure, teacher training, and targeted welfare measures is essential to ensure equitable educational outcomes. Second question, preventive healthcare remains the weakest pillar of India's health policy despite increased public spending. Evaluate this statement, examine how Telangana Health Initiative attempt to shift the focus from curative to preventive care. India's health policy has traditionally focused on curative care despite growing recognition of preventive healthcare importance under the National Health Policy 2017. Preventive healthcare remains weak due to low awareness, inadequate primary healthcare infrastructure, and a disproportionate spending on tertiary care. Schemes Ayushman Bharat largely focuses on hospitalization rather than prevention. Lifestyle discusses malnutrition and food sanitization continue to burden the system. Health and wellness centers under Ayushman Bharat aim to provide preventive and promote care. Nationwide programs for immunization, sanitization, and nutrition also contribute. Telangana has made notable efforts to shift towards preventive care. Initiatives like Basti Davakanas bring primary health care close to urban poor, while Arogyasri complements this with financial protection. Programs focusing on maternal and child health, screening camps, and awareness drives reflect a gradual shift towards prevention. Yet challenges such as shortage of healthcare personnel, uneven rural outreach, and limited behavioral change hinder effectiveness. Conclusion: while India and Telangana are moving towards preventive healthcare, it remains undeveloped. Strengthening primary healthcare, increasing awareness, and reallocating resources towards prevention are crucial for a sustainable and equitable health system. Day 68 answers. First question, discuss the major poverty elevation programs implemented in India and Telangana, evaluate their effectiveness, and suggest measures for better outcomes. Poverty elevation remains a core objective of India's development policy, focusing on income support, employment generation, social security to ensure inclusive growth. At the national level, key programs include Manrega, which provides rural employment and wage security. National Food Security Act ensuring subsidized food and Dindalli Yojana promoting self-employment through SSG. Direct benefit transfer has improved efficiently by reducing leakages. In Telangana, innovative schemes like Raitu Bandhu, Asara pensions, and KCR kits for maternal welfare have significantly improved living standards. Effectiveness: these programs have reduced extreme poverty, improved rural consumption, and enhanced financial inclusion. Telangana targeted welfare has shown better last mile delivery compared to many states. Challenges: persist leakages, exclusion errors, inadequate targeting, and depending on subsidies. Manrega faces delays in wage payments, while agriculture schemes sometimes exclude talented farmers. Regional disparities and urban poverty remains less addressed. Measures strengthening DBT architecture improve beneficiaries identification through data integration, enhancing skill development, and focusing on urban employment schemes are essential. Convergence of schemes and outcomes based monitoring can improve effectiveness. Conclusion: while poverty elevation programs have achieved significant programs, a shift towards sustainable livelihoods and inclusive targeting is necessary for long-term poverty reduction. Second question: examine the key welfare schemes for scheduled caste in India and Telangana aimed at social justice and economic empowerment. Analyze the challenges in implementation and suggest reforms for inclusive development. Welfare schemes for scheduled caste aim to address historical discrimination and promote social justice and economic empowerment in line with constitutional mandates. At the national level, schemes like scheduled caste sub-plan ensure dedicated funding, while post-matric scholarship scheme promotes education. Stand Up India scheme encourages essay entrepreneurship and financial inclusion. In Telangana, initiatives such as Dalit Bandhu provide direct capital assistance for entrepreneurship, marking a shift from welfare to empowerment. Impact: these schemes have improved literacy rates, income levels, and representation in education and employment. Telangana's Dalit Bandhu is notable for its sale and direct benefit approach. Challenges: implementation gaps, fund diversion, lack of awareness, bureaucratic levels, and prevention of social discriminations. Many beneficiaries lack the capacity or support to efficiently utilize funds, limiting long term impact. Reforms: capacity building, skill training, and market linkages are crucial for sustainable employment. Strengthening monitoring mechanisms, ensuring transparency, and increasing community participation can improve outcomes. Addressing social barriers alongside economic support is equally important. Conclusion: SC welfare schemes have made notable progress, but a holistic approach combining economic support with social transformation is essential for achieving true inclusive development. So these are the four answers. For further more videos, please like, share, and subscribe my channel. Thanks for watching.